In 2014, majority of religious leaders were against use of contraception.
FP Plus brought social accountability where each religious leader felt I have a responsibility to play.
The 2014 survey, we were at 32.8. We are now at 50% in terms of contraceptive prevalence rate.
We've seen teenage pregnancy reducing, and we are also seeing maternal mortality reducing.
We've had a lot of gains with HP Plus.
Majority of the cultural leaders were not aware of methods of contraception, and that led to a very low contraceptive prevalence rate in the county of that 2.8. That led the county to be one of the 16 counties, interest counties that had the lowest contraceptive prevalence rates and the highest fertility rates. In 2019 then, we started co-creating this program, the program of the engagement where the religious leaders were to be engaged and the cultural leaders were to be engaged. We looked at the county profile, what are our priorities, and then we were able to prioritize various areas of intervention that would lead to increased uptake of advocacy for family planning by these special interest groups. So after the co-creation, then we started engaging with them.
Worked with HP Plus from around 2016 to date, and they've been our major or go-to partner when it comes to matters healthcare financing. One of the areas I think we've worked with HP Plus is especially issues matters advocacy.
HP Plus came to the department, they met with the CHMT, and they were given a green light to start engaging with the unit of reproductive health that time, particularly on matters to do with family planning advocacy. Their target was actually to work with, to bring in the aspect of religious leaders and other special interest groups that ordinarily were not embracing family planning.
At the end of the day, we as professionals will entice the community to seek for services. But it will only take one sermon of one religious leader to overturn the work that we've done for over 10 years or within the field of health services. But it will also take one sermon to build various milestones and also improve uptake of FP services. The aspect of social accountability has really helped in the programming of organization because it has brought another angle of using human right-based approach, where now our programming not only focus on what is right for me and you, but basically goes beyond that, and we put aside our religiosity and bring humanity first before our religion. We selected religious leaders across the entire county, having representatives from each sub-county. We went ahead now to look for religious scriptures that either hinder someone from accessing FP services or actually approves uptake of FP services.
Wakati mwingi watu walikuwa wakiona mpangilio uzazi ni kana kwamba ni fikra ya western, ni fikra imeletwa na wazungu. So hata ukamweleza vipi, katika akili yake ashafunga kwa hii ni fikra imefanya kuletwa. So ndo namweleza kwa pole, ikiwa utapanga, na tumeambiwa kwa Qur'ani A, B, C, D, anaangalia mpaka anaona kweli hizi calculation ni za kweli.
It brought a lot of change because we actually got champions from the among the religious leaders. We have ustads, we have pastors who can now be called family planning champions within the county, who know the profile of the county in terms of family planning and the methods and what have you.
And we also want to replicate whatever we've piloted in Kilifi, which we've seen it work. We want to replicate the same in the surrounding coastal coastal counties.